Good afternoon, North Dakota. Thanks for tuning in. Got a lot to cover today, so we'll jump right in, but I want to take us back to the very beginning of this pandemic. And at the very beginning, we said we wanted to focus on facts, not fear. We want to continue that dialogue today. We know that nationally right now, there's a lot of focus on what I'll call numerators, which is the number of new cases that are coming. And of course, that's going to be a fact. When we increase testing, we're going to have more cases. So it's very important that we make sure that we're doing our math. We're going to talk a lot about education today. So this is some basic math. We got to make sure that we're focusing on the percent positives. We got to focus on hospitalization capacity. We got to focus on the basics that we've been talking about since the beginning. And those things that we've talked about through this whole thing, we haven't moved any of the goalposts in North Dakota since day one, which is we said we're going to slow the spread. We're going to do that by doing some very common sense basic things, being North Dakota smart. We're going to do that to preserve hospital capacity, to make sure that we could take care of people at the highest level, and we're going to work to save lives and livelihoods. And we've accomplished that together. But as we look across the country, we see these outbreaks that are occurring, not just increases in the numerator, but actually increases in positivity rate. And was on a call yesterday with a White House call, heard from as part of that call from the governors of South Carolina, from Texas, from Arizona and others, where we've got the states that are right now very hot, a lot of people inside with air conditioning could be one factor, but they're skyrocketing in some cases in both their positivity rate and their cases. But it's also, we have other states like Idaho which have gone into double-digit positivity rates, and it's more similar climate to ours. So I think the important thing today, if you're tuning in, you're part of the team that's helping be North Dakota Smart. You're part of the group that is doing the great work. So gratitude for you for tuning in and listening. We still have work to do, and it's not time for us to change course. We got to hold the course, not change the goalposts, but we must continue to be North Dakota smart to keep COVID-19 in check, and that way we can keep our businesses open, we can keep our lives moving forward, we can help save lives, and we can get all of our kids back in K-12, and we can get our universities back open again in the fall. So we're on the right track, but it's going to take work and effort for us to get there. One of the things in terms of our goals remains unchanged in terms of the basic strategy has to do with testing. And this is one of the tools that we have, which is, you test, you find out where the positives are, you trace to find out who they've been in contact with, and then you ask those people to isolate so that they don't cause additional infection. This slows the spread. It preserves hospital capacity. It allowed us to build up our testing capacity. It allowed us to build up our PPE supplies. And like I said, this has been our plan from the beginning, and it has worked. It will continue to work, but it's up to each of you to continue to be North Dakota smart. But we also did other things that we were able to do in terms of saving lives and livelihoods. And again, another reason why we've had such great success in North Dakota and due to so many. But our Vulnerable Population Protection Plan, which we called VP3, we've reduced our long-term cases now down to 15. There's only 15 positive cases among residents out of close to 10,000 people that are in long-term care, assisted living, or basic care. We have just about 15 staff positive cases as well. That's a huge change. We'll have a slide on that later. Steps like our emergency rent bridge program that we put in to stabilize housing situations helped us to keep people and avoid them from moving into a position of homelessness. It reduced the people that lost their ability to have access to housing, and that has worked very well. Our emergency grant program for child care providers has helped over 1,000 small businesses that provide child care services stay in business and keep going, and they were able to provide child care services for our health, safety, and other lifeline workers. And again, in working with the legislature, We've distributed about $930 million so far of our $1.25 billion in coronavirus relief funding, which is part of over $4 billion of federal support that has gone directly to individuals, gone directly to businesses, to hospitals, to schools, to airports and airlines and others across the state. So together, great work has been done that's put us in this situation we're in now. But that brings us up to I should bring up a slide right now on cases on long-term care. I mean, this is a great slide that shows what we can do in all working together in terms of saving lives. Back earlier this spring, the blue represents active cases among staff. The yellow part of this graph recommends active residents, and you can see we've got this down. And the important number here is really the yellow number on the yellow bars in the bottom. That's where we've got only 15 positives among residents in the state. This is one reason why we've seen our number of deaths decline, even as cases has risen, because we've done a great job of doing two things simultaneously. We've protected those that are most vulnerable, and we've also reunited them with their families with our very thoughtful approach to getting visitation going. Again, one of the few states in the country that's been able to do this and do it safely. So great work to everybody involved in the VP3 team, Chris Jones and your whole team, and thanks to everybody, all the administrators that work in the long-term care and their staff for the great work they've done to do this, because this involves improved infection control practices in every one of our 218 facilities, better use of PPE, and of course family members as also being smart in terms of their visitation. And so again, this is a credit goes to a lot of folks, but that's exciting to see those kinds of results. Well, let's talk about our case numbers. Yesterday, we saw a single count of 108 positives. Our record daily reported positives was 134 back on May 21. When we compare those positives, from earlier in May until now, it's important to note again, so we don't get caught up in the numerator problem. We reported almost 1,800 fewer tests back on that day in May than the 4,564 we reported yesterday. So the positivity rate yesterday, higher than it has been, and trending up slightly, was 2.4%. On May 21st, it was more than double, or 4.9%. And so again, we're not alarmed by when we have more tests and we've got more cases. That's good news when we find cases, because that means we can, when we find them, then we can trace who they've been in contact with. We can ask people to isolate, and we can slow the spread. And so we're doing this at a 2.4% rate today, which is which again substantially more testing than we were when we had going back in May, and so that's a good thing. So we also have been doing a lot of serial testing, and we'll take a look at that right here, which is, again, the blue on here is the serial testing, and this is, again, very valid, very important when we're going back and testing healthcare workers who might have been having repeat exposures. It's as important as testing someone who's newly tested. And the reason why we say that, and when we include that, if we flip back to the prior slide, that over the last week, we had a new record, 31,029 tests completed over the last week. So again, thank you to everybody involved in collecting those tests, from local public health districts to federally supported local clinics, to our tribal partners, to our healthcare groups, the National Guard. 31,029 individuals or tests that were collected. Some of those individuals are being tested for the second time, again, particularly if they're in healthcare or long-term care, but only 1.9% of those in the last week, so under 2%. Yesterday's rate was up slightly from that, but the 7-day total was 1.9. That 1.9% of tests, or 601 positives out of 31,000 tests, again, puts us among the best states in the nation in terms of low positivity rate. So we like the position we're in. We have tested 125,000 different individual North Dakotans, and when we take a look at those individuals and the cumulative positives of 4,493, that's what gives us the 3.6% positive rate for the entire course of the pandemic. pandemic. So again, serial testing, which is, again, important to what we're doing. We'll see more of the serial testing. As more and more North Dakotans get tested, we'll end up with more and more people getting serial tested, because particularly when we get into education, sometimes we're going to have to test people more than once. The net case breakdown at 720 puts us at again, from a numerator standpoint, that's the highest we've been in terms of active confirmed cases, higher than we were back in May. But again, when we take a look at, when we overlay those active cases with the daily test conducted, you can see again that our testing is up substantially from that point in May. And this again makes the same point that we made just a moment ago, which is that today we can have a record number of tests at a 2.4% positivity rate, or that was yesterday, or 1.9%, or below 2% for the entire last 7 days. When back in May we had those cases, we were close to 5% positive. So we feel that even though active cases is what we have to actually physically manage and be ready to deal with, the fact that we've got the lower positivity rate gives us a lot of confidence. The additional testing capacity gives us a lot of confidence that we're on the right track. The great job we're doing on contact tracing gets us confidence that the 720 active cases, that we know where they are, and we know that those people are isolating away from others, and so we feel good about our ability to continue to manage, because what we were managing healthcare capacity, and we only have 42 people hospitalized in the state right now, and that is a spread widely across state. Those 42 hospitalizations are occurring in 16 different counties. There are 11 people that are in ICU, and of course our thoughts go out to their families, because we know that if you're in ICU with this with COVID-19, that's not a great place to be, because this is a tough disease and can run a very tough course for people. But those 11 ICUs are spread into 8 different counties. So again, one thing we are seeing now versus earlier on is we are seeing, with this increased testing, we're picking up the fact that COVID is spread more widely. I think on Saturday's report, we reported positive cases in 25 of our 53 counties. I believe that was the most amount of spread we'd had in a single day in terms of cases. Some of those were single cases in a county. But again, when we look at the hospitalization rate here, where we're at 42, 43 yesterday was our record high, but at 42, one above where we were back in May, and so you'd say, well, gee, we've got more active cases but less hospitalization. Sometimes there's a lag on hospitalization that trails behind active cases, so we want to be prepared for this to maybe potentially continue to rise going forward. But the other thing we should know is that we are also seeing a big drop in the age of the individuals that are showing up as positive. And the good news for those that are younger and don't have underlying health conditions is that the course of this disease can be less severe and seldom requires hospitalization. So we can be in a position where we have substantially more cases, but we're not putting pressure on our hospitalization rate. Again, let's to be clear for those that don't remember these numbers from last spring, but less than 2% of our inpatient hospital beds in the state are occupied by COVID-19, and over 40% of our current overall hospital bed capacity. There's over 900 beds in the state right now that are currently unoccupied. Less than 4% of the ICU beds are currently occupied by COVID cases. There's nearly 150 beds available right now on ICU, and that doesn't include our surge capacity, which again allows us to surge up to thousands of more beds than what we have right now in just in the overall general bed capacity. And we know that some of our great care providers and hospital organizations have the ability to increase the number of ICU beds. So we are barely scratching the surface on hospitalization, but we're focusing on this point a little more today, because one of the things we heard on the White House call yesterday was that while other states may have beds available because of sometimes the COVID spreading among healthcare workers, and when there was a healthcare worker shortage in our country prior to COVID, that some places are reporting shortages in healthcare worker capacity in the states that are seeing these big increases. The federal government is surging some personnel into states like Texas and Arizona to assist. We are not in that situation now, and we'll continue to monitor that closely. We've got our team that was working on healthcare workforce earlier. As part of a meeting yesterday, we've reactivated that group to make sure that we're planning ahead in case we do find that we need additional healthcare workers. We'll be ready, but right now we've got a lot of capacity. One of the other things we want to provide a brief update on is the Burley and Morton County update. We offer Burley and Morton together as two because they're, I think the number from DOT is that there's some very large number, 80 to 90,000 crossings a day on the multiple bridges in the interstate highway between the two counties, so effectively one metro area when we're talking about the Bismarck-Mandan area, even though divided by the beautiful Missouri River. This is where we've seen some of the biggest rises in cases, and we've also had a big increase in testing here, but the 14-day rolling average of these will compare this going all the way back. The blue line shows Cass County, where that's was able to drop down substantially and then is now trending more in line with the state line. Burley and Morton was below the state average for a long period of time, and then now is trending up and sort of matching Cass. So the 14-day rolling percent of positive tests, Burley Morton's at 2.25 today, which is double to or slightly less than double 1.2% 2 weeks ago, and it's just below Cass County's 14-day average of 2.5. The statewide rate is 1.8. And again, rate of positivity is an important indicator, and it provides insights into whether the community is conducting enough testing to find cases. If your positivity rate is really high, like in some of these outbreak rates down south, it suggests that they may be largely testing the sickest patients and they might be missing the milder or asymptomatic. Lower positivity may indicate the community is including testing patients with mild or no symptoms, which is what we've been trying to do, particularly if we can identify younger asymptomatic carriers and have them isolate. That can help us slow the spread and keep our economy open and again, saving lives and livelihoods. One of the things that they talk about before reopening, there's a lot of talk about whether reopening in the southern states led to these outbreaks. It's important to know, it was covered by Dr. Brooks yesterday in our White House call, that this narrative about the reopening leading to the outbreaks doesn't actually match up with the facts. The early indications of these slight rises started in the week of June 10th to June 16th. That was a couple weeks after all of the activities around the Memorial Day weekend and the weekend holiday, and that was something that, again, if you take a look at the half a dozen or more states that are growing the fastest, they did not all reopen at the same time. Some had been open for 2 weeks, some had been open for 6 or 7 weeks, and so the date of reopening is not a direct indicator of when these cases started to increase. So I would say, again, there's more unknowns than knowns, but again, it does appear that perhaps we know that this disease spreads more rapidly indoors and in closed conditions and in places with less ventilation, and they're experiencing temperatures in excess of 100 degrees right now, daily highs in Arizona, Southern California, and other places. I'm sure people know that, those that have been to Arizona know that drives everybody indoors and maybe into more confined spaces. And so again, I want to remind everybody that one of the things that we can do here in North Dakota is take it outside. Whatever activity you have, it's probably safer to do it outside. So whether it's meetings or phone calls or small groups or dining, let's think about taking advantage of that and adding the great North Dakota outdoors into our North Dakota Smart game plan as we go through the summer and the early fall. Arizona reported 4,273 new cases today out of 20,647 tests. Their positivity rate, by comparison, we've just been talking about here in North Dakota in the 1s and 2s is over 20%. That's from the Arizona Department of Health. And California yesterday reported close to 8,400 new cases, prompting Governor Newsom to order the closure of indoor businesses, restaurants, bars, wineries, movie theaters, zoos, museum. Florida had 9,200 new cases. Again, the appeal here to North Dakotans is let's not go backwards on the scale. Let's keep moving forward and avoid we can avoid the fate that others are seeing by being North Dakota smart. Those people, we've heard people say, hey, I don't know anybody that got coronavirus. I just want to share some of the things we're learning from our contact tracing team, because the virus doesn't discriminate. It discriminates in terms of how deadly it is by age and underlying condition, but it can be transmitted by people of any age. And some of the clusters of cases that are popping up have been related to parties, some to socializing on sports teams. As someone who played softball in city leagues for over 30 years. I understand the joy of sitting on the fender of a pickup after playing a doubleheader with a group of your best buds. But it is again, if people are doing that, let's make sure that we're exercising social distancing and being smart about that. One of the things we noticed in states where they closed the bars, when they closed the bars, this led to young people having large house parties. Didn't really solve a problem. It actually created a different one, and again, because it's really about confined spaces. So if people are going to gather this summer, if you want to gather with friends, figure out a way to do that outside if you can, and keep some distance. We have had some people from North Dakota who've traveled to hotspot states and returned. We had one tracing that led to an out-of-state funeral in a Sunbelt state, and the families, 10 different individuals that were at that funeral in a Sunbelt came back to North Dakota to 3 different cities, and so 10 people tested positive in 3 North Dakota cities, all connected back to one out-of-state funeral. There was a 4th of July party that was large that was held at a private residence that's had numerous contacts traced back to that. Of course, again, we continue to monitor child care centers just like we do long-term care. We've had some incidents there. We've had a couple of small clusters that have been related to bars. And so again, to our bar and restaurant owners, if you want to keep open and earn customer confidence, make sure that you're practicing good work there in terms of social distancing. And then we did have a bank in North Dakota where there were 7 co-workers that worked in close proximity. The bank lobby was closed, as most bank lobbies are, transactions online. But again, even when you're going back to work, it's important to think about how do you socially distance at work. So just sharing some contact tracing information, because I think those scenarios, this is about making sure that we don't get complacent in North Dakota, and we can again avoid falling into the situation that other states are with rapidly rising rates. The main risk factor among cases in North Dakota is actually being a household contact or in close contact. 71% of the cases are being in one of those 2 categories. So if you're going to end up getting this, you're probably going to get it from someone that you work closely with or that you share households. So again, if you think about your own pod or the people that you're hanging out with, if all of you are practicing good social distancing, but one isn't, one individual in your household is going out to parties, going out to doing this close contact activity and then coming back into your household, that creates a risk factor for all of you. So again, make sure across your group that you're being North Dakota smart. Everybody is. That's the way, again, to slow the spread. Our statewide active cases increased between July 1 and July 12, 129%. Same period in June, they decreased about 11%. So this is why we're spending a little more time today talking about the why we need to make sure that we're being very thoughtful about how we are practicing North Dakota Smart, because we are in a period of increase right now. So again, we do feel well positioned. We do have hospital capacity that's available, but again, we need to remain North Dakota Smart, social distance, wear a mask when appropriate, use good hygiene, hand washing. If you think about the trillions of dollars in stimulus that has been spent by the federal government, and then you say, what is the most effective tools? Social distancing, wearing a mask, and using good hygiene. And these things are practically free compared to all the other things we've talked about. And then the other thing, which again we'll add to this advice, is take it outside, because that's another good way to really slow the spread. Next topic is K-12 announcement. We've been working with K-12 parents, educators, students, education community. This has been, since the very beginning, since the first case, we've been working hand in hand, arm in arm, collaboratively. And I just want to say right off the bat, you know, the gratitude I have for everybody involved in education in North Dakota. On behalf of Superintendent Baszler and myself, we want to say thank you to all of you who've been navigating so well through this rapidly evolving situation. And as we look towards school, everybody says, what's school going to look like in the fall? But I want to take a moment and say again, thank you to everybody, because we did execute this spring on a very rapid, unexpected, never before seen, having to take 120,000 school kids in North Dakota and move to distance learning in a matter of weeks. Really remarkable. We know that in other states and in some districts in other states, when school closed, they did not even begin distance learning. So as for all the challenges we had in distant learning, we were still engaging students, we were still moving and working, we were learning as parents, learning as teachers, learning as administrators, learning and growing in terms of how do we deliver education during a pandemic. And the pandemic has changed the delivery of education as we know it, and it's going to change it throughout this school year and maybe longer. It's challenging everybody involved in education to become more innovative, to become more nimble and more responsive to the needs of students wherever they may be. And we've also learned, of course, through this whole thing, we said that we learned new things. We had the importance of the student-teacher relationship was always well known. It became critically important. I think parents became more empathetic of that as they had to step into the role of helping teach at home. But it's a critically important element to the educational success and the well-being of every child. And I think also for teachers, it helped them create greater empathy of what was going on in the homes and the challenges that some students might have been facing on the home front. So greater empathy by both parents and teachers, one positive element of this. COVID-19 forced us to adopt new practices and technologies at a really incredible and startling rate. And we confirmed what we've known to be true, which is that no student learns the same way. And we have a responsibility as the funders, as the adults, as the deliverers of education, to make sure that during this time of pandemic that we serve every student, those that are challenged and those that are gifted in ways that we can, and using all the tools that we have. And that's going to mean for us as adults that we have to do things differently and like never before. Educators have an opportunity to combine the strengths of multiple delivery models. They can use technology where it works well, providing student voice and student choice, and then maintaining the foundation of education, which is that student and teacher relationship. Distance learning in North Dakota was successful in many ways, but it challenged relationships, and it's also important that we step back and say, what did we learn from doing those millions of days cumulative? I mean, it was over a couple of months in the spring, but times over 100,000 students a day, millions of student days worth of distance learning to learn what worked and what didn't work. I mean, this is a opportunity for us to move decades ahead in our understanding of what we can do to serve all of our students. Since March 13th, when we first issued the COVID-19 related guidance for our educators, tribal leaders, stakeholders, everybody's engaged, the Department of Public Instruction, the Department of Health, the Governor's Office. And as you recall, we closed schools to in-person instruction due to COVID-19 on March 15th. That was just 4 days after the first case was identified, and that was on a Sunday. And so in some cases, first case was Wednesday, press conference Thursday morning, Friday some schools didn't have school, Sunday we closed schools. I think of this like turning off a light switch. That was the easy part. It was a hard decision, important, difficult decision. Reopening the schools is going to be a much more of a challenge than it was to close them, and it's going to take more leadership from more people across the state. By April 1, all public schools had their distance learning plans approved for implementation. Again, great job to our 175 school districts. School buildings were closed to students. The essential staff continued to plan, serve, and support students in both public and non-public settings across the state. And again, that included important missions like the nutrition mission, where the staff came in and was cooking and serving and delivering meals. And again, I can't stress again how grateful that Superintendent Baszler and I are for the monumental task accomplished this past spring in transitioning the students to a learning model. We couldn't have done it without the dedication, the support of teachers, leaders, communities, state partners, and of course parents who took on huge new roles. So now, here we are. North Dakota's got low positivity rates, which we talked about at the beginning. We've got a North Dakota smart and committed population that remains vigilant to make sure we're not getting complacent. We're going to make sure that we're going to continue to have low numbers going forward to give us the best chance of reopening in the late summer and fall. And we are now today going to be talking about the updated North Dakota Smart K-12 restart guidance with an effort to reopen K-12 buildings as one of the tools that we can use because this is where the buildings were closed, but the schools were not this last spring. The school mission carried on, but without the use of the buildings. But this is new territory for all of us. You know, we acted swiftly and smartly to close schools to in-person instruction. That is probably one of the reasons why we avoided the fate of some other states that had the big upswings last spring. We have not yet had to manage in-person teaching and learning for these 121,000 K-12 students during the COVID-19 pandemic. So this has always been uncharted territory, and now we move into new territory this fall with a dual purpose. We need to focus on providing the highest quality education to all of our students, and we also have to safeguard the health and safety of those students and the staff and the faculty and the administration and their families that they go home to, including their grandparents and others that are most vulnerable in the communities in which these schools operate. And so this dual mission of both education and public health is going to add some new challenges and some new thought processes, some new efforts to what we've had to do in the past when we think about the normal kind of big effort of getting back to school every fall. But in the last several months, we've collaborated with education associations, tribal leaders, stakeholders, and partners on the reopening. One of the clear themes emerged, which is they wanted to have timely guidance to help plan for in-person instruction. There's certainly a desire among parents and others to get back to the resumption of extracurricular activities and other programs. And today we're providing that guidance for all North Dakota public schools in our K-12 Smart Restart guidelines. We won't go through the guidelines line by line. I'm going to highlight a few main points. Superintendent Baszler's here. She's going to go a little deeper on some of this, but I want to first touch on some of the guiding principles, which is first and foremost, we have a responsibility. We have a responsibility to the students, and we have a responsibility to the taxpayers, which is, again, as we know, within the state budget, K-12 education is about a $2 billion item in the state budget, one of the largest, and certainly it's the largest because it's one of the most important things we do is to educate the future, which is as we say, the students represent 100% of our future. But now we have to do it in a way that's, we got to deliver that full year of education. And we have to do that in a manner that's safe for everyone involved. Districts are going to have to work. They have worked in collaboration in the past with health professionals and local public health units, but this collaboration is going to get deeper than ever before. When we take a look at the overlying maps of the state, which the superintendent has on her website, when we take a look at school districts overlaid by counties, overlaid by local public health districts, it is a jigsaw puzzle. We're going to work to make sure that every school knows exactly who is the individual they need to contact and be in contact with within their local public health district, and we're going to make sure that the local public health districts have the resources they need to be assisting schools in their local, their execution of their health and safety plans. The guiding principles also acknowledge that schools are congregate settings. We know that congregate settings create more transmissible moments, and therefore we know that we're adding risk back into the equation by putting more people back into buildings. And in some case, we're putting people back into buildings that were designed specifically to make sure the windows never opened, because that was one of the things that we do when we design schools sometimes is, hey, we're going to let it all work through the HVAC system. Again, schools are going to have to think about those physical closures. Do they need to be modified? What things can be moved outside? How can we create more distance? How do we use the buildings in new ways than we have before? Because even within the buildings, it's congregate within a classroom, and then there's even more congregation when we think about hey, a bell rings and you've got 4 minutes to get to your next class, and sort of everybody remembers that the adrenaline associated with getting from one room to another as everybody passes by each other in a crowded hallway. We have to figure out a way to do things differently than it's been done since these buildings and this kind of education with a classrooms connected by hallways, connected with a cafeteria, and everybody eating at once and standing in line. We just have to really rethink all of these elements. It's not about flicking the light. We flicked the light switch off in the spring. That was easy. Flicking it back on in the fall isn't just, we're not turning it back on to the same thing we were. We have to, just like every business has had to, just like every agency in the state of North Dakota has had to, is that K-12 schools have to think about how are they going to deliver education in those buildings in a way that allows them to stay open. This will cause us to make sure that we're ready to do two things. One is the health and safety plans, which are going to be required, and the second thing is also going to be the distance learning plans. Depending on local conditions, instruction may be face-to-face, it may be virtual, it may be hybrid or two, and this leads me to my next point, which is probably one of the most important ones here. When we decided to close the schools, we had input from health officials, we had inputs from local when we made the decision. We closed them statewide. When schools reopen, school boards are going to play a vital role in this as this incredible year unfolds. Situations can change daily, policies and best practices, building layouts within a district. The public is going to be looking to their school district leadership teams to provide messages to their employees, parents, students, and general public as the hundreds and thousands of situations that occur that come up when we have a positive student, when we get a positive faculty member, when we've got faculty members and teachers that may be at risk because of underlying conditions. There are literally thousands and thousands of decisions that are going to have to be made by our 175 school boards. And so this guidance provides a framework, but we're going to be in partner, and we believe in local control. We believe in the importance of flexible decision making as we go forward. Let me give you some reasons why that is. In Adams County in North Dakota, home of Hettinger as its county seat. Confusingly, Hettinger, the city, is not in Hettinger, the county. Hettinger, the city, is in Adams County, but Adams County has yet to report a single case of COVID-19. Golden Valley, also out west, reported its first case during the entire pandemic today. 6 counties have only one positive case reported. 29 of our 53 counties have 10 or fewer. So some school districts find themselves in counties that have had almost no prevalence of this. They have to be ready for that to change, but this is why we have local control, because a decision there may be different than a decision where we may have a school in a metro area that is in a center of an area that may be experiencing an outbreak. Under these guidelines, each district school board will have to approve a health and safety plan, which is developed in consultation with their local public unit. Also, each school board will have an approved distance distance learning plan on file, which is going to be an updated version of the one they used last spring. But the expectations for these plans are higher because of all the learning, and they should expect, districts should expect that this is not like the tornado plan that you make and put in the file and hopefully never see even during a 30 or 40-year career. The distance learning plan that is, quote, on file and it needs to be approved is a plan that likely will have to be used at some point during the time for some of your students. And our goal is that we would, the superintendent and I share this goal, is that we would hope this year to never have to close schools statewide. The chance that we might have to you know, if there's a breakout in a classroom and a classroom gets, everybody in that classroom gets sent home, if there's a building that gets closed but the district remains open, if there's a district that gets closed but other districts in the same health unit stay open, all of these scenarios can occur, and we should not just plan for them, we should actually expect for them to happen. For the parents, once these plans are approved, the two plans, the health and safety plan and the distance learning plan, they'll be required to be published on the district's website, and so parents will have an opportunity to transparently see what all of the work is. And again, for those in local public health, we have an expectation that local public health, when we work in collaboration with these schools, that across these 430 plus buildings that we have, that there needs to be, the health and safety plan is not district level, it's building level, because each building has got different configuration. It's going to have different opportunities to create that physical distancing. The K-12 Smart Restart Plan requires school to take into consideration this hybrid approach, because again, you may have students that have underlying health conditions that from day one may be uncomfortable heading back into the situation, and so how are we going to take care of serving all of the students? The CDC has released two documents to help states and school plans. These documents, along with the North Dakota Smart Restart guidance and the health guidelines, formed the foundation of the guidance, and our K-12 guidance uses the same color-coded health guidance as the overall North Dakota Smart Restart, ranging in risk from red to orange to yellow to green to blue, blue meaning the most open. Currently we're in low risk, which is the green phase, and under this phase schools may provide in-person instruction after developing a written health and safety plan approved by the school board in consultation with their local public health. Superintendent Basler will discuss those plans in a moment. We should also note that each district is required to conduct tribal consultations as appropriate under the Every Student Succeeds Act, and so those districts must also do that with tribal leadership. We've also got a separate group, which is our 15 residential education facilities. These are, when we say residential, these are schools in North Dakota that have dormitory, and those are also required to implement North Dakota Department of Health recommendations for congregate setting to ensure the safety, health, and overall well-being of students and faculty. We know there's going to be lots of questions about different scenarios. We won't have those answers today, because each of those districts, the answer may be different. And this, again, back to providing local control, local leader decision making to help make those decisions in each particular situation in consultation with their local public health. That'll be our path forward. But it's why we're releasing the guidelines now. We said we'd have them out in mid-July. It's July 14th. We know that this will lead to more questions as soon as we release these, but these are unique times and they'll require leadership everywhere, and school boards are going to have to be very involved. And given the dynamic nature of the COVID-19 pandemic, this K-12 guidance that we're issuing today we'll issue it online. It's got a bunch of links. Those links will be updated as further research data and resources become available. So this will be a very living set of guidance. Our commitment to supporting and partnering with schools as they provide safe, quality educational experience for all our students remains our top priority. I'd also right now like to turn it over to Superintendent Basler to talk more about community involvement in the school reopening process, as well as the distance learning plans, the health and safety plans, and of course, again, deep gratitude to Superintendent Basler and her team. They've been working tirelessly and around the clock since the beginning of the pandemic. They have not let up for a day this summer, and we're grateful for her leadership and appreciate her being here today. Superintendent Basler.
Thank you, Governor. And good afternoon to all of you. Thank you to all of you for being here today, and for everyone who's here today and everyone who's listening for your interest and your commitment to K-12 education. This new North Dakota K-12 Smart Restart update takes a community approach to reopening schools. Many school districts have been working on their plans for the fall based on K-12 guidance released this spring. And we are very, very grateful to those school districts that did that. As they shared their polling with their communities, with their students, with their staff, that was very helpful to the governor and I and to Dr. Stahl as we anticipated what those needs would be, what those questions are, and what those concerns are. So thank you to our local school district leaders out there who have already begun working on their fall plans based on the K-12 guidance that we released this spring. This is an updated plan, and it has important changes from the one that we released in May for summer school. This plan allows for, as the governor said, consideration of local context and local conditions. It puts decisions in the hands of local school boards, administrators, in consultation with their local health units, families, teachers, and students. As the governor said, we are not planning any statewide school shutdown. In fact, this is my 31st, I'm just starting my 32nd year in K-12 education. I hope that I never see another statewide shutdown of our K-12 system again in my career. Because we do not expect for students to be prohibited from face-to-face instruction that we know is vital to so many. But now our communities can utilize this K-12 Smart Restart update along with information from the State Health Department, the Centers for Disease Control and Prevention, and other resources for guidance. School boards and administrators now have the information they need to make decisions for the education of children while keeping the safety of their communities in mind. North Dakota has never managed in-person teaching and learning for 121,000 students during a pandemic. As the governor stated, we are entering new territory this fall as schools begin to serve that dual purpose for our state, educating all students and safeguarding the health and safety of students, staff, families, and communities. The North Dakota K-12 Smart Restart provides a guidance and expectation to meet both of those purposes. Local communities can decide if teaching and learning will be face-to-face, done by distance learning, or a hybrid of the two. Each district must develop a health and safety plan and update their distance learning plans. Both plans must be created in consultation with faculty, families, staff, students, and the local public health units. And those plans must be published on the district's website. Each district that is required to conduct tribal consultations under the Every Student Succeeds Act, and there are 2 stipulating requirements for those school districts, they must also consult with tribal leadership on the distance learning and health and safety plans as well. School districts will utilize the state's STAR system for school approval to assure that there are school board approved plans meeting all expectations for both distance learning and health and safety protocols and procedures prior to school buildings opening or student services being provided on their campuses. Non-public, private, or parochial schools are strongly encouraged to create both plans and also publish those plans on their website. School boards and administrators will be making difficult decisions to ensure the health and well-being of their communities and limit the spread of COVID-19 while fulfilling their overall mission of educating students. They are in the best position to make the dozens and dozens of judgment calls that will be necessary every day and changing as the days go on. As school boards and administrators work with families, faculty, staff, students, and communities on these decisions, communication across and among all parties will be key in this work. The North Dakota K-12 Smart Restart Guidance outlines the details of what a school health and safety plan must have. Some highlights include schools must identify a COVID-19 team or coordinator to oversee health and safety preparedness and response planning. There must be a plan for communication and training about the health and safety plan. Schools must outline a process for isolation and quarantine when a staff member, student, or visitor becomes sick or demonstrates a history of exposure. They must detail a process to rapidly notify parents and staff of exposures in the school settings. They must develop a process for identifying and protecting children and staff at higher risk with an opportunity for continued distance teaching and learning. And they must also create protocols for social distancing. Our distance learning plans must also be updated. Equity for all students is a critical consideration when improving these distance learning plans. Much grace was given this spring to all of us. Schools, students, teachers, families, but we recognize these are improvements that can and must be made to existing plans in order to qualify for full student foundation aid payments. There should be a strong and explicit commitment to supporting employees and families with technical support and professional development. School districts will be required to assess all of their students, grades kindergarten through 12, within the first 4 weeks of school to learn exactly how and what the individual students should begin being taught. And distance learning plans must include descriptions of how each school district will have students demonstrate their ongoing understanding and growth toward academic proficiency, both at grade level and above. Grading practices and grading policies for a district must be detailed in the plan. It should be noted that school boards set their district's calendar. So we've often gotten the question, can schools start later if more time is needed for planning and training? Or conversely, can schools start earlier if schools want to prepare for a future disruption and want to bank some time before winter sets in? The answer to that question is yes. School districts must put in a certain amount of hours beginning July 1st through June 30th. Our school boards approve our local district calendars. This guidance will most certainly evolve as more information and research becomes available. We all need to be flexible and keep open minds about how to best manage this unprecedented situation. And before I close, I want to say again how deeply grateful I am to the Governor's Office, to Dr. Stahl and his Department of Health, to all of our community leaders, our school district leaders, and all of the stakeholders that have reached out to our office, stopped me in the grocery store to share their comments, their suggestions, and their commendations for the great work we've done. We are in unprecedented times, but we will make it through this together. In closing, I truly want to bring it back to the why all of this matters. Why is the Governor's Office? Why is Dr. Stahl and his team at the Department of Health? Why are the team members up at the Department of Public Instruction putting in so much time and energy to be very careful and explicit about these decisions? And it's because North Dakota's children are looking to us as adults to help them adjust to a world with COVID-19. They will be watching us and looking to us for answers, guidance, and security in their new life as it exists. Today's guidance begins our next step in this journey, in this responsibility that we have to our youngest citizens of North Dakota. We don't know all the answers. As we said, this is the first time that we've educated 121,000 students under a pandemic. But we are committed to supporting and partnering with all of our schools and families to provide a safe, high-quality education for all students to the best of our ability. Thank you. Thank you, Governor.
Thank you, Superintendent Basler, and Superintendent Basler will be available afterwards for questions. Our next topic we're going to talk about is immunizations, and it relates a little bit to what we were just talking about. We know that there's always been a relationship between K-12 and public health, and one of those intersections is it tied into state law. North Dakota Century Code mandates that children entering school be up to date on required immunizations per the requirements for their age. We want to announce today these requirements will not be loosened or delayed due to the COVID-19 pandemic. Children should be up to date prior to starting school. There is a grace period that if they are meant to be ready before you enter the school building, that would be the safest for everybody. If they're not up to date by October 1st, then per state law, the school must exclude the child. But given everything we're going through right now, again, would encourage parents to work with their healthcare providers or local public health to make sure that you've got all your immunizations up to speed before you actually get back into school. And why are we talking about this? We're talking about this because we have a couple of slides. The first one I want to bring up here is the weekly doses. Hopefully you can see this on the slide. The orange is actually the administration of doses to children ages 18 and younger in North Dakota through January 1st through May 31st. That covers the first part of this when we had this. The gray bars represent 2019, the orange is 2020. You see that they start to diverge dramatically when we get into that after the little marker there where the first case is. So just to help people if you can't read the things in there, and some of these, those are 3,000 or 4,000 students represented in one of those gray bars that did not get an immunization this spring during about each week during a period of about 6 weeks there. So we know we've got a large lag of children that were meant to get their annual vaccinations this spring when people were not going to the healthcare providers during the spring initial time of this after the first case and for the first couple months. That wasn't happening. And now we've got some catch up to do between now and the 6 weeks between now and when sort of Labor Day gets around and it's time to head back into school. Another slide on this shows coverage rates for students. This is for the younger, but again, when yellow is below gray, that indicates that we're behind. And you can see we've got some gaps there both in pre-K and in the 7th grade and up through high school. So this is again a reminder. We've talked about it before, but these rules remain in place, and so we encourage all parents to that. We encourage schools to work with local public health if they need to set up, as they do sometimes in the gym, the immunization clinics to make it easy for students to come to their school and get vaccinated before get back in school. So that's that announcement. One other element that we want to talk about here is the child care, and local school districts as they work to restart their schools and communities. Department of Human Services is also going to be working with child care providers in those school districts to best align with each school district plan, because some of these plans may or may not include, depending on what happens if we've got to have less density in schools. That may create more pressure on child care providers on days of the week. And so again, Human Services stands ready to work in coordination with the K-12 community. We recognize that child care plays an important part of a strong family strategy to ensure the health, safety, and well-being of everyone. And of course, we have done great work in keeping the child care sector alive with the Child Care Emergency Operating Grants. So again, thanks to the team that worked on that. I should just note on immunizations, one last thing is cost should not be a barrier to this. The Vaccines for Children program is a federal entitlement program, provides vaccines at no cost to healthcare providers for children who are under 18, Medicaid eligible, uninsured, underinsured, or American Indian, Alaska Native. Parents should ask about their healthcare provider or local public health about the Vaccines for Children program in case you qualify. And then also flu shots. The flu vaccine will be more important than ever. It's recommended, as we have in pre-COVID, that everyone 6 months or older is recommended to be vaccinated. Yet only about half of North Dakotans get their flu vaccine. Parents are encouraged to get their children vaccinated against flu this fall when it becomes available. The flu will prevent children from missing school due to illness, parents missing work to take care of sick kids. And of course, again, we know that unlike COVID, which is thankfully not a deadly disease for young children. The flu can be. When we did our announcement last fall, one of the people here in the Capitol that presented with me was a mother who lost a beautiful 2-year-old daughter to the flu. And so again, a reminder that comparisons between COVID and the flu, we should be careful about how we make those, because the flu is actually can be more deadly to children. Long-term care update, we want to talk about for briefly, which is, again, we shared at the very beginning that we've had this great success in terms of how we're managing that. I want to talk just briefly about visitation. There are currently 160 facilities that have met the gating criteria. That's 160 out of 218 to go into phase 2. That's where internal visitation within the facility at scheduled intervals is permitted, while adhering to what they call the universal source control measures, but that's the infection control measures. Furthermore, this week, some of the facilities who were in counties that had remained all the way in the new normal classification for long-term care facilities, they reached another milestone, propelling them into phase 3. As of today, we're pleased to announce there are 13 facilities across North Dakota who are nearing the finish line of the phased reopening approach. Our long-term care guidance was developed with clinical oversight to ensure that North Dakota Smart, safe, and resident-centered approaches governs the reopening, where most of our vulnerable population resides. But then, however, due to the recent upswing in COVID cases in North Dakota, we are seeing some facilities that might be entering a holding pattern, and it has nothing to do with the facility, but it has to do with the heightened prevalence of active COVID cases per capita within their associated county. So the VP3 task force will continue to closely monitor this evolving. We'll keep working with those facilities, because again, we're using the prevalence in the county as a measure, because that's probably an indication of whether or not those long-term care workers might be more likely to bring COVID into a facility where everybody's gone through, tested twice, all the residents are negative, they've gone through that twice. We want to make sure we're not reintroducing it into those facilities. So again, we ask all visitors be mindful of the importance of following the guidelines to help mitigate that. And again, wearing face masks during your visit, maintaining your distance, avoiding touching the outside of your mask or taking it down anytime during a visit, and then making sure that whoever you're visiting with is wearing a mask, maintaining social distancing, meet outside if you can, and perform the appropriate hand hygiene upon entering the facility, after touching services, and prior to leaving, and avoid visitation if you've been ill or potentially exposed. Again, these are extra care that we're taking, but it's to protect the extra special citizens, our elders, who are most vulnerable. We are also, again, continuing to collaborate with Augusta Place, which is a Prospera community here in Bismarck, on a pilot to accelerate testing and visitation controlled study, which has allowed enhanced visitation benefits. So again, this is where we're testing the visitors. This pilot's vital as we look to new ways to continue visitation and advancement towards the new normal with an extra layer of security. It was mentioned by Admiral General Gerard yesterday during the White House Coronavirus Task Force meeting that the federal government is undertaking an effort to acquire as many as 15,000 point-of-care machines that could be delivered to long-term care facilities for the purpose of testing workers and residents. And the federal government right now is undertaking the cost of the machines plus the first 500 tests. Those 2,000 of those machines are going to roll out in the next week, but they're going to go to areas where there's high positivity rates. So think of those machines as test machines as going to the Sun Belt area, but they're committed to getting to all of the skilled nursing facilities in the country. So again, we'll have another federal program to work with, so we may be able to broaden the Augusta Place pilot that we're doing with more direct point of care testing that would allow people to get tested and then visit that same day. Economic resiliency programs update is our next topic. We wanted to remind North Dakota businesses that the application period for the PPP, this is the Federal Payroll Protection Plan, it remains open until August 8th, so there's a little over 3 weeks left for that. It's a great program for businesses that positively benefits the workforce of North Dakota, and the added flexibility that was created by it makes it even easier for businesses to have a loan forgiven, essentially turning the money into a grant. We wanted to remind businesses on the upcoming Economic Resiliency Grant, or the ERG, that was through the North Dakota Commerce Department and coming out of the support of the North Dakota Legislature and the Emergency Commission. The program providing grant fund to companies for business improvements to help reduce the spread of COVID-19, reinstill consumer confidence. Again, those are grants, and those the grant round application for the ERG opens on July 31st. More information can be found at ndresponse.gov under COVID Business and Employer Resources. And again, these are for improvements that you may be making within your own business, whether it's touchless faucets or plexiglass at checkout and many other ideas. Those are things these grants can help pay for those improvements. Commerce Department will also announce today application window for the North Dakota Smart Restart Technical Skill Training Grant. That's anticipated to open on July 20th. This grant is designed to support accelerated skill-based hands-on workforce training for displaced workers who are seeking to develop the technical skills necessary to make a career change. So if you've found yourself in an industry and you've had a chance to reflect and you want to think about a new career with a higher set of skills, again, visit commerce.nd.gov and take a look there for the North Dakota Smart Restart Technical Skill Training Grants. Behavioral health update, which we've offered in each one of these. We know that providing care to others during at any time can lead to stress, anxiety, fear, and sadness and other strong emotions. But during this pandemic, it's critical that we support the healthcare workers that are supporting and taking care of our most vulnerable citizens, whether it's in long-term care, clinics, hospitals, or home and community-based care. By recognizing what stress looks like, taking steps to build resiliency and cope with stress, knowing where to go if you need help. These are all important. Our own North Dakota Department of Human Services is announcing an award. It's going to Sanford Health to develop and implement a comprehensive strategy to engage, treat, and provide recovery support to healthcare practitioners addressing the stress or mental issues as a result of COVID-19. This collaboration will provide much needed support to our dedicated and incredible healthcare workers across the state of North Dakota. Sanford will provide outreach and engagement to healthcare practitioners, including those working in mental health, support hotline for healthcare workers, information and resources on resiliency, coping, promotion of a 24/7 crisis hotlines, proactive outreach to healthcare workers, including targeted communication of all those who've been working so dedicated in our long-term care facilities or in intensive care units, and then other services. This grant is funded by a $2 million emergency grant to address the mental and substance use disorders the state received from the Federal Substance Abuse and Mental Health Services Administration, or SAMHSA. It's also a reminder that free and confidential crisis counseling is available right now to all North Dakotans, and visit projectrenew.nd.gov or call 701-223-1510. Free, confidential, don't hesitate. give them a call if you're under stress and need to talk to anybody about anything right now. We also want to express our gratitude to all the healthcare workers providing vital services from North Dakota clinics as well to hospitals and long-term health care. Thank you all for the great work you're doing. On our good news section for today, summer is an opportunity to participate in a number of educational athletic camps. We know that a number of those may have been postponed or canceled. This year, with in-person camps and programming presenting challenges, NDSU Extension and 4-H program leaders are taking advantage of virtual opportunities to engage with children using Zoom. Instructors and camp counselors are providing 12 camps across a variety of products and topics, using 3D printing, an escape room puzzle experience, STEM topics, sewing and coding and entrepreneurship. Over 100 people have already participated in these virtual camps. More than 300 are expected to participate. They're free, they're open to the public for 4-H aged children and both enrolled 4-H members, and you can be just a member of the public. You don't have to be a 4-H member. They've been popular this year, and they'll reach children across the state that might have not been able to take a week off or are interested or not able to attend the 4-H camp in Washburn during a normal year, so that we could broaden the participation. So again, if you want to learn more about these clinics, which include photography, showmanship clinics, environmental series, and more, visit www.ndsu.edu/4H and the North Dakota 4-H STEM Facebook for more opportunities. And again, take advantage of these. They're available, they're free. Get your kids engaged with some great learning on virtual summer camps. Gratitude, a quote for the day. Alan Conan, 70-year-old American author, says, "Gratitude, like faith, is a muscle. The more you use it, the stronger it grows, and the more power you have to use it in your behalf. If you do not practice gratefulness, its benefication will go unnoticed. Your capacity to draw on its gifts will be diminished. The opposite, to be grateful, is to find blessings in everything. This is the most powerful attitude to adopt, for there are blessings in everything, and we are blessed here in North Dakota." One final announcement. Next Tuesday, July 21st, we're here talking about education all day. Probably should have said this at the top headline, but we have got a great 4th annual summit on innovative education coming up next Tuesday. We've got Saul Kahn of the now famous Khan Academy, one of the great leaders in online resources for mathematics and now lots of other things. Dean Kamen, who holds, I think, over 400 patents. He's really our modern day Thomas Edison. He invented the Segway. He is the founder of First Robotics, which has touched millions of kids around the world in some very intense robotics competitions. George Koros, noted leader and educational leader, an author, will be as part of this as well. So again, we're going virtual. You can sign up. We encourage everyone to reserve your space now to attend next week the 2020 Innovative Education Summit.eventbrite.com. And because of that summit is next Tuesday, 8:30 to 4:30, Superintendent Baszler will be there the entire day. I'll be online the entire day. She and I will also both be doing welcomes and participating during the day and helping host that. Again, 2020 Innovative Education Summit at eventbrite.com. I think there's over 750 people already registered. That's more than we've ever had attend an in-person event. We look forward to having you participate and learn. But due to the summit, for those that are tuning in here and for our partners in the media, we'll be back here next Wednesday at 3:30 versus next Tuesday at 3:30. So next Wednesday at 3:30 will be the next press briefing. Until then, be North Dakota smart, stay home, stay healthy, stay connected. And with that, we'll take time to stand for a few questions.